Air pollution is more than just a haze. It is a public health emergency. In India, our cities are choked with toxic fumes, and our people are paying the price with their health. The air we breathe is laden with particulate matter, nitrogen dioxide, sulfur dioxide, and ozone, all of which have severe consequences for human health. Asthma, chronic obstructive pulmonary disease, and lung cancer are all on the rise, with air pollution being a major contributing factor. It is particularly alarming to see the number of children suffering from respiratory problems due to poor air quality. Studies have shown a clear link between air pollution and an increased risk of heart attacks, strokes, and other cardiovascular diseases. Emerging research has linked air pollution to an increased risk of neurodegenerative diseases like Alzheimer's and Parkinson's. The health consequences of air pollution translate into a significant economic burden on individuals, families, and the nation as a whole. The costs of treating respiratory illnesses, cardiovascular diseases, and other pollution-related ailments are staggering. Individuals and families face the brunt of these expenses, often draining their savings or falling into debt to access healthcare. The loss of productivity due to illness and premature death associated with air pollution further exacerbates the economic impact. When people are sick or unable to work due to pollution-related health problems, it affects their earning capacity and overall economic well-being. Hospitals and clinics are overwhelmed with patients suffering from respiratory and other pollution-related illnesses. This surge in demand stretches resources thin, making it challenging to provide timely and quality care to all those in need. The government's healthcare budget is also severely strained by the rising tide of pollution-related diseases. A significant portion of public health expenditure is now directed towards treating these preventable illnesses, diverting resources from other crucial areas like sanitation, nutrition, and infectious disease control. Quantifying the full economic impact of air pollution is a complex task, but various studies have attempted to estimate the costs. According to a 2020 report by Greenpeace Southeast Asia and the Center for Research on Energy and Clean Air, air pollution cost India $150 billion in 2019, equivalent to 5.4% of its GDP. This figure takes into account healthcare costs, productivity losses, and premature deaths attributable to air pollution. Another study published in The Lancet Planetary Health in 2021 found that air pollution was responsible for 1.67 million deaths in India in 2019. The study also estimated that air pollution resulted in $36.8 billion in economic losses due to premature deaths and morbidity. The World Bank estimates that air pollution costs the global economy trillions of dollars each year. These figures, though staggering, likely underestimate the true cost of air pollution, as they do not fully account for the long-term health impacts, damage to ecosystems, and other indirect costs. The true burden of air pollution on society is likely far greater than what current estimates capture. The consequences of inaction on air pollution are dire, both for public health and the economy. As air pollution levels continue to rise, so too will the incidence of respiratory illnesses, cardiovascular diseases, and other pollution-related ailments. This will further strain our healthcare system, increase out-of-pocket expenses for individuals and families, and lead to a decline in productivity and economic output. The World Health Organization estimates that air pollution contributes to 7 million premature deaths globally each year. India, with its rapidly growing population and industrialization, is particularly vulnerable to the health and economic impacts of air pollution. Failure to address air pollution will also have significant implications for India's development goals. The economic costs of inaction are substantial and will only escalate over time. Addressing air pollution is not merely an environmental concern, it is an economic imperative. Recognizing the severity of the air pollution crisis, the Indian government has taken some steps to address the issue. The National Clean Air Programme, launched in 2019, aims to reduce particulate matter pollution by 20 to 30% by 2024. The program focuses on improving air quality in 102 cities across India through a range of measures, including strengthening air quality monitoring, promoting cleaner fuels, and implementing stricter emission standards for vehicles and industries. The government has also implemented the Faster Adoption and Manufacturing of Hybrid and Electric Vehicles in India scheme to encourage the adoption of electric vehicles. The scheme provides subsidies for the purchase of electric vehicles and aims to reduce the number of polluting vehicles on the road. Additionally, efforts are being made to promote public transport and improve fuel quality. While these initiatives are steps in the right direction, much more needs to be done to effectively combat air pollution in India. There is a need for stricter enforcement of existing regulations, greater investment in public transport, and a shift towards cleaner sources of energy. Public awareness and participation are crucial to tackling air pollution. Addressing air pollution is not just about mitigating health risks, it is about securing a healthier, more prosperous future for all Indians. By cleaning up our air, we can reduce the burden on our healthcare system, improve productivity, and enhance the overall quality of life for our citizens. A healthy population is a productive population, and a clean environment is essential for sustainable economic growth. The fight against air pollution requires a collective effort. The government must implement and enforce stricter regulations, invest in sustainable infrastructure, and promote clean energy solutions. Industries need to adopt cleaner technologies and reduce their environmental footprint, and citizens must demand cleaner air, adopt sustainable practices, and hold their leaders accountable. The time for action is now. Let us work together to clear the air and build a healthier, more prosperous future for all.